today. Um, it would seem the more regulations we have, the more difficult it becomes. At least medical providers tell me that it's more difficult to do their job, and especially it becomes more difficult to do the right thing. And Mr. Cavanaugh, similar to concerns raised about the 2-midnight rule, there's another regulation CMS announced it will begin enforcing this year pertaining to the 96-hour rule at critical access hospitals. This regulation requires, as you know, physicians to certify at the time of admission they do not believe a patient will be there more than 96 hours or must transfer the patient or face non-reimbursement. I understand CMS has walked back this rule, allowing more time to file this certification. Is that true?
That's true. We've provided guidance to some of the hospitals that we will allow the certification to occur anytime up to 24 hours before the bill is submitted, and I think that will be coming out more formally sometime soon.
Okay. I assume that you have received a good bit of feedback, as have I, from hospitals and physicians. Can you reflect a little bit, briefly, if you might, on the kind of feedback you received that would have prompted walking the rule back a bit?
Certainly we got a lot of input about the timing and the burden and whether the trade-off between what we were seeking and what the hospitals were requesting, whether there was any loss in the assurances we needed that the patient was seeing the appropriate level of professional. And I think the hospitals made a convincing case that there was room for some adjustment in the policy.
It would seem that the rule is unnecessary and even arbitrary. How did you arrive at the actual number of 96 hours?
Well, sir, that part is in statute. The statute requires that the physician make a certification that the expectation when the patient arrived was that they would need no more than 96 hours.
What is the background on that 96 number?
I apologize. I don't know the story there. I just know it's statutory based.
And I mean, CMS has not enforced it up until, they've finally decided to start enforcing that. Is that accurate? They have not been previously?
Again, I apologize. I've been in the job for just a couple of weeks. I do know that the requirement does trace back to the statute.
Okay. I've introduced a bill, H.R. 3993, the Critical Access Hospital Relief Act of 2014, which would repeal the regulation, and I would certainly encourage the agency's support of that. I think it might even make a lot of folks' jobs more easy to carry out. And I know that we've got other burdens on critical access hospitals, such as the physician supervision, again, arbitrary, hard to determine how that ever even came about in terms of a rule or regulation. And it's very discouraging, I think, for medical providers to be facing all of these regulations that, like I said earlier, make it difficult for the good actor to do the right thing. I know we've seen advertising on television about addressing fraud in Medicare and Medicaid and other areas, and yet I still think that all of these regulations are making it more difficult for the provider to do the right thing. I'm not convinced that it's actually preventing fraud. I can appreciate the fact that there are limited resources, that you acknowledge that, and that we are all trying to operate in a world of limited resources, and yet I think that many of these regulations are accomplishing the exact opposite of what they were intending to accomplish. And it's a huge burden, and I would hope that the agency would really reflect on that fact as we do move forward. Thank you, Mr. Chairman.